So the traditional healthcare model was really about that paternalistic kind of way of looking after people, but almost telling them what's best for them, what's best to do, or if we saw somebody had a problem, we'd say, okay, we'll try and fix it. And so we were disempowering people.
In mental health, we have a very broad range of approaches, and that's why we have what we refer to as our multidisciplinary teams. And we tend to provide as holistic approach as we possibly can. That being said, there is a limit to what clinicians can provide, and that's why these community-based programs provide such an important aspect to an overall package of care.
Traditional healthcare models are more focused on medical specific illnesses, diagnosis, treatments, whereas with the Sláintecare programs such as social prescribing, this addresses social needs of clients.
We as healthcare professionals are able to see how the individuals benefit from an MDT point of view. We're linking in with our public health nurses, our GPs, and we're able to get feedback where sometimes we see these people ourselves engaging in different groups and they may not necessarily be coming back into OT, but we're getting feedback from different services like physios, public health nurse, and they're able to tell us that how well these people are doing and how they're improving in the community.
I think that's probably one of the most rewarding things is that, we can help people and encourage them, but when they kind of take flight and go off and do their own things, it's much more rewarding. And it gives us a greater sense of kind of achievement of what we have brought to the person. And we know that they're going to do so much better. And it gives us a confidence that they're less likely to be referred back again in the future.
It's very positive to see clients move forward in their recovery journey, building social support networks around them. They're gaining more confidence, they're learning new skills.
When we go into someone's home to assess them, we're opening up a conversation to happen about, looking at someone holistically at home and reflecting back on making every contact count in the training that we done. We think of where else can we redirect this person to get the best out of our service.
It's preventative rather than reactive. I think in the health system, we all hear about trolleys and wait lists, and that's all trying to, I suppose, kind of deal with what's there at the time and manage people's ill health. So I suppose the community approach is trying to stop that before it happens. Trying to do programs like self-management programs, like walk-in programs, whatever it is to stop that before people get unwell or chronically unwell.
I think under ideal circumstances, everybody will be managed in the community. Unfortunately, there will always be a need for hospitalisation, but people will recover, they will come back out into the community, and that's why these programs are so very important. I think we will always rely on clinicians and multidisciplinary teams, but I think having those extra strings to our bow will be a really important part of delivering care.